We'll talk about the biochemical processes involved in hemostasis. Now, I want you to know something. They are not saying homeostasis. Because a lot of students, when they just see this word, it's like an automatic O appears here. No, it's not what? Sorry. The O, an automatic E. Sorry. The automatic E appears here. It will now be looking like hemostasis. No, this is hemostasis. And when you see hem, anywhere you see hem, all right, hemosiderin, hemoglobin, and the rest, they're just talking about blood. All right, so biochemical process involved in what? The process of blood clotting. All right, so let's have the full question. They said that hemostasis is the cessation of bleeding that follows traumatic interruption of vascular integrity. Right, so exhaustively what? Describe the biochemical process involved in this. It's quite simple. Because the whole process of what hemostasis is for series of reaction. All of them are biochemical processes, if you ask me. All right. So it's now left for you to arrange it well. If it is a primary hemostasis, it's just briefly. I don't think it even involves the blood pathway, all right? Because just the platelets can be able to now clot the blood, all right, clot the wound, okay? But if it is a very big wound now, it now involves the coagulation pathway. All right. So you have to know your coagulation pathway. You have to know the primary hemostasis, what is involved. Okay. You have to know the process of fibrinolysis. All right. You have to just, these are the three things that you know. So as you know these three things now, you just list what is involved in each of these steps. And those are the biochemical processes. All right. So first of all, let's define and go. We said that hemostasis is a process by which body maintains body vessel what? Blood vessel integrity and prevents excessive bleeding. So your body is just trying to what? Regulate how bleeding occurs, right? So let's talk about the various biochemical processes involved in hemostasis now. For primary hemostasis, this is what we are talking about in primary hemostasis, right? There's an injury, all right, there's a VPC, all right, vasoconstriction, platelet plug formation, and clot formation. All right, let's see what we have here. Vasoconstriction, platelet, platelet what? Plug formation is still the activation, right? Aggregation is still clotting, all right? So different texts will just have the way they put the name, all right? But me, I know it as VPC. That was how I used to cram it, okay? So in this vasoconstriction, first of all, there's a problem. The blood vessel now isolate itself. Do you understand? It's just like you are working with your group of friends and all of a sudden they start behaving abnormal. You just withdraw yourself because this is not how your parents trained you. Okay. So vasoconstriction and platelet adhesion is when the platelets will now stick to the damaged vessel. The platelet activation. Okay, the platelet will release what? Chemical signals. Alright, that will activate it. Then platelet aggregation. The platelet that were there before, other platelets will now come and start joining them. So they'll be clumping on each other. And this is what will now what? Form clots. This one is, okay, this is a primary hemostasis, right? Then the big guy is a coagulation cascade. So you must actually know how to draw the coagulation cascade. You shouldn't miss the coagulation cascade because till the end of your medical school, they will always be talking about the coagulation cascade and they will always be asking you to draw it. So you just have to fall in love with it, all right? And there are so many images of coagulation cascade, let me tell you. And all of them, they have different ways in which to draw the coagulation cascade. Just find one that you are compatible with and learn, all right? A coagulation cascade is a coagulation cascade, no matter how you draw it, okay? So just find one and learn because coagulation cascade is something that you always be asked for it, okay? So intrinsic pathway, we are not talking about the intrinsic pathway now. Intrinsic pathway now, you just be focusing on the reactions, right? So factor 7 activation, factor, okay, no. This is X11, right? That's factor 12 activation, factor 11 activation, factor 9 activation, factor 8 activation, all right? Those are the reactions that go on. So those are the biochemical processes. Then for extrinsic pathway now, there's a tissue factor release. See the tissue factor release. Then there's factor 7 activation. There's factor 10 activation. All right. Then when these pathways come here, this one come here, and they meet at this common pathway. All right. There are some couple of biochemistry reactions that still go on. All right. So let's talk about them. Prothrombin, that's what? Activation. Prothrombin activation. All right. Fibrinogen conversion to fibrin. Then ultimately the clot formation. All right. All these are biochemical processes. Oh, this image was even a lot better. Wow. Okay, so you can see this is a prothrombin activation to thrombin. All right. Fibrinogen activation to what? Fibrin. Then from here, the clot is formed. All right. So the release of the tissue factor to that was on the extrinsic pathway. So I think this is the best image. Very, very cute. All right. Very, very fine. You just learn how to draw it. Is everything is nice. All right. Then looking at the coagulation factors. All right. There are some that are vitamin K dependent. Now, I think this is out of context, right? It's too high. All right. Then fibrinolysis is like the process at which what clot is broken down. All right. So this is the body trying to control. All right. There's a wound, there's clot formation, but let there not be too much clot. Do you understand? So if there's too much clot, there's a way the body can break it down for a while. Do you understand? So you can break it down by what? Plasminogen activation, plasmin formation, fibrin degradation, clot dissolution. Right? No. I think that's just it about the biochemical processes involved in hemostasis.